Good day, everybody. Welcome to the new Johannesburg Surgical Hospital in Northcliffe, South Africa. I'm Dr. Bester. I'm an interventional radiologist. My colleague is Dr. Franz Snyman. He's a renowned orthopedic surgeon who specializes in bone tumor as well as sepsis. We are very excited and pleased to announce that we have successfully performed the first MSK Cryoblation case in South Africa of a osteoma bone tumor. I'm going to give over to Dr. Franz Snyman to explain a little bit more about the lesion and what we did. Thank you, Franz.
Thank you, Joel. The patient was referred to me via Bloemfontein from the Northern Cape. He lives in Kathu. I have a colleague who sent him to me. We know that osteoid osteomas are small little benign tumors that causes immense pain. The tumor is usually less than 1 centimeter in diameter and it causes a lot of very hard bone formation around this tumor. The tumor sits in the cortex of the bone and they are quite tricky to find because of the hard bone that they produce. Previously we had to do large open surgery with an open wound that you find in the area of the tumor, and then you had to burr away cortex in layers to try and find this small little hole in the middle of all this hard bone and then try and burr it out. I did a fellowship in Birmingham in the Royal Orthopedic Hospital many years ago, and in that unit the radiology department ablated these small little benign tumors. So I discussed with Dr. Bester whether we cannot do such a case in Johannesburg Surgical using all our state-of-the-art equipment that we have here. In effect, we needed to find the lesion with the machines in the background, and then I placed 2 parallel wires above and below this lesion because I could now see exactly where the wires were with this machine in the background. And then we drilled 2 channels over these wires that were placed just adjacent to the tumor. And then Dr. Bester will tell you what we did with the channels and the argon probes.
So the cryoblation machine is a machine from Boston Scientific. It's the ICE-FX, and it uses argon gas, which is pumped through small little needles, 1.5 millimeter in diameter, the ice sphere needle. You get different types of needles that forms different types of sizes of ice balls. So you have to evaluate the lesion, measure it before the time on CT to make sure that you cover the whole lesion. That is why we use 2 probes so we can actually cover the whole lesion adequately. So we pumped argon gas and formed a ice ball for about 10 minutes of active freezing, and then you've got 6 minutes of relaxation time, and then you freeze again for 10 minutes, and that basically forms a nice ice ball around this lesion, which destroys the whole lesion and takes it out. So the 2 probes was placed exactly at the right spot. We did a tomography, a tomo CT, just to make sure that the probes were correctly positioned using this machine behind us. This is the Artis Icono biplanar angiography suite, and it's got a very nice biopsy function where you can stereotactically plan your biopsy track to make sure that you are exactly in the right position. You do the tomo afterwards then just to confirm that your probes are correctly positioned. So it was a successful cryoablation. We were very excited, we were very happy, the patient was very happy, and Dr. Franz can tell us how the patient did after the procedure.
The following morning I saw him in the ward. He had no problems. He had 2 little puncture wounds on his leg and his pain was completely gone. The pain that he experienced for weeks. He was discharged before lunchtime back to Katu the following morning. Looking forward to more corroboration like this.
Definitely. Cryoblation is a great new procedure, minimally invasive, decreases the time of admission, decreases the complications that you can have with surgery. Really looking forward to do more cases together. Thank you, Franz.
Thank you.